Histology, submitted for histologic analysis, are sections of brain, there were 2 samples, unremarkable cerebral parenchyma, heart, there is myocyte hypertrophy, lung, there is moderate congestion and patchy slight interstitial fibrosis, liver is unremarkable, kidney, there is medullary congestion, testes, there is atrophy of the spermatogonia, thickened basement membrane, and interstitial edema with arrest of germ cell maturation. Well, I'm going to have to look into what that means. My goodness. Adrenal gland, there is slight autolytic change. Evidence, submitted as evidence are the ligature, towel, and a bloodstain card. Photography, post-mortem photographs are taken and retained. Opinion, this 40-year-old man, Chris Benoit, died as a result of hanging himself. After review of scene photographs, discussions with investigators, and autopsy findings, the decedent hanged himself using a rope from his exercise machine. The ligature furrow around the neck, in conjunction with no other significant trauma, supports the manner of death as being suicidal. Post-mortem toxicology revealed blood levels of alprazolam at 50 micrograms per liter and hydrocodone at 45 micrograms per liter, both of which fall within the therapeutic range. There was an elevated level of testosterone in his urine, with an elevated testosterone to epitestosterone ratio, signifying an exogenous source of testosterone. Then it says, so disclaimer here, only those items discussed in the results above were analyzed for this report. The above represents the interpretations/opinions of the undersigned analyst. Evidence analyzed in this report will be returned to the submitting agency. Biological evidence, body fluids and tissues, and fire debris extracts will be destroyed after 1 year. This report may not be reproduced except in full without written permission of the laboratory. And which I did, because then here's the last page. It says this case may contain evidence that must be preserved in accordance with, and then it's a statute there, 17-5-56, which is the Georgia Code of Law regarding maintenance of physical evidence containing biological matter. And then this line right here, I guess, is the signature of Jonathan Eisenstadt, who is the medical examiner. And then that's the end of the official report. So I have completely presented this report in full. Oh, and also in the description box below, you will find links to a medical glossary and to a website that explains anatomical position and directional terms if you'd like to explore these autopsy reports more thoroughly. We're going to go look at Nancy's autopsy now. All right, and here we are at Nancy Benoit's autopsy, and you can see all of the official stuff there. Division of Forensic Sciences, case individuals, victim Nancy Benoit, results and conclusions. Final diagnosis. Number 1, strangulation with A, ligature furrow around neck, B, hemorrhage, soft tissues of anterior and posterior neck, thyroid gland, upper mid back, upper mid chest, and tongue. C, ligatures recovered. Number 2, blunt impact of head with A, subscapular soft tissue hemorrhage, right side. 3, blunt impact of lower extremities with A, contusions and abrasions. 4, C toxicology report. 5, status post-remote cervical spine fusion. 6, marked decompositional changes. Cause of death, strangulation. Manner of death, homicide, ligature strangulation. I hereby certify that I, Jonathan Eisenstadt, M.D., in accordance with the Georgia Death Investigation Act, have performed an autopsy on the body of Nancy Benoit on the 26th day of June 2007, commencing at 2:00 p.m. in the morgue of the Georgia Bureau of Investigation, Division of Forensic Sciences. External examination. The body is of a well-developed, well-nourished, 5'5" 138-pound, tan-skinned woman whose age cannot be assessed due to post-mortem changes. The scalp hair is coarse, brown, and up to 14 inches. The eyes have brown irides and the corneas are cloudy. The conjunctivae are unable to be assessed for petechiae, hemorrhage, or jaundice due to postmortem changes. Ugh. The oral cavity has natural teeth in good repair and an atraumatic mucosa. The nose and facial bones are palpably intact. The extremities show no scars overlying subcutaneous vessels. The ends of the nails are painted white. The external genitalia are atraumatic and of a normal adult. A 4-inch vertical scar is in the mid-lower back. A polychromatic tattoo of a heart is on the posterior neck. Postmortem changes. There is no rigor or livor mortis appreciated. The body is cold, refrigerated. Marked decompositional changes include the foul odor of decomposition, green discoloration of the face, torso, arms, and thighs, skin slippage of the torso and extremities, and blister formation and bloating of the face, external genitalia, and anus. The green discoloration of the arms extends to the wrists, where the ligatures are tied, but is not present on the hands. There are fly eggs in the right axilla. The internal organs are soft. Clothing. On the body are 1 white tank top, 1 tan bra, 1 multicolored pair of pants, and 1 pair of white underpants. These are submitted as evidence. 2 yellow metal rings, 1 with a clear stone, is on the left 4th finger, and 2 yellow metal earrings with clear stones are in the ears. These are submitted as personal effects and released with the body. Injuries, external and internal. A 1/4-inch wide ligature furrow surrounds the entire neck. It remains horizontal around the entire circumference of the neck. The skin within the furrow is pale and red. Around the neck are 2 tight ligatures. One of the ligatures is a tan rope, which is 1/4 inch wide and 54 inches long. It is looped twice around the neck, and there are 2 knots at one end of the rope. The rope is tied at the mid-posterior neck. That means it's tied in the middle of the back of her neck. The rope is intertwined with the other ligature, which is a 5/16 inch wide and 54 inch long coaxial cable. Wait a second. So the rope just happens to be the exact same length as the coaxial cable? What are the odds of that? And where did this rope come from? Did they ever figure that out? I don't know a lot of people who just have rope laying around their house. Do you? The coaxial cable is looped around the entire neck once, with one end extending along the upper left back and the other end extending along the upper right back. The 2 ends are tied around the left wrist and right hand with a knot positioned between both hands. There are ligature compression marks on both wrists and the right palm. An S cable is tied 3 times around both wrists and knotted on the left wrist. It is 1/8 inch wide and 48 inches long. There are ligature furrows around both wrists. There is black tape and a black electrical charger looped multiple times around both ankles. The electrical charger, black tape, S cable, rope, coaxial cable, and a multicolored blanket are submitted as evidence. Internally, there are no fractures of the hyoid bone, thyroid, or cricoid cartilage or vertebrae. Focal hemorrhage is in the right side of the tongue. There is hemorrhage throughout the soft tissues of the upper chest and anterior inferior neck, as well as focal hemorrhage within the thyroid gland. Hemorrhage is within the soft tissues of the inferior aspect of the posterior neck and upper portion of the back. Blunt impact of head. There is marked hemorrhage in the right side subscapular soft tissues. There are no skull fractures. Blunt impact of extremities. Multiple purple contusions are on the legs and right buttocks as follows. A 1/2 inch in diameter on proximal right thigh. 1/2 inch in diameter on lateral right thigh. Multiple 1/4 to 2 inch on right knee. 1/4 inch in diameter on anterior mid right leg. 2 1.5 inch in diameter on inferior right buttock. 1 3/4 inch on medial left thigh. 1 by 3/4 inch on medial left thigh, a 1.5 by 1/4 inch on medial mid left thigh, 1 inch in diameter on medial left knee, 3/4 inch by 1/4 inch on the left popliteal fossa. There is a 1/8 inch in diameter pink contusion on the anterior lateral right leg, and a 1/4 by 1/8 inch pink contusion on the anterior mid right leg. A 1/2 inch in diameter purple-blue contusion is on the left knee. A 1 by 3/4 inch purple-blue contusion is on the anterior proximal left leg, and a 3/4 inch in diameter purple-blue contusion is on the mid-anterior left leg. There are areas of green-purple discoloration on the right buttock and left leg that are unable to be determined if they are injuries or post-mortem changes. That's interesting. I wonder how they can tell the difference between bruises and post-mortem changes. Like, for real, I'm not trying to say she didn't have bruises. That's interesting. There is a patterned abrasion over a 1.5 inch area on the anterior right ankle and a 1/4 inch in diameter abrasion on the proximal right big toe. There are no fractures of the extremities. These injuries, having been described above, will not be repeated. Internal examination. Head. There is no epidural, subdural, or subarachnoid hemorrhage. The brain weighs 1,170 grams and has a normal distribution of unremarkable cranial nerves and cerebral vessels. The leptomeninges are thin and delicate. The brain is soft. The brain is symmetrical with normal distributions of white and gray matter, deep nuclei, and ventricles. There are no focal lesions. Neck. The upper airway is not obstructed. Body cavities. 10 milliliters of decomposition fluid is in the right pleural cavity, and 10 milliliters of decomposition fluid is in the left pleural cavity. No abnormal fluid accumulation is in the pericardial or peritoneal cavities. The organs are in their normal situs without fibrous adhesions. Cardiovascular system. The heart weighs 250 grams and has a normal distribution of widely patent right dominant coronary arteries. The myocardium is uniformly tan red without pallor, hemorrhage, or fibrosis. The heart is diffusely soft. The left ventricle wall is 1.2 centimeters thick and the right is 0.2 centimeters thick. The endocardial surfaces and 4 cardiac valves are unremarkable. The aorta is without atherosclerosis. The vena cava and pulmonary arteries are without thrombus and embolus. Respiratory system. The right lung weighs 420 grams and the left weighs 290 grams. The parenchyma is red-purple, without focal consolidation, hemorrhage, obstruction, or cavitary lesion. The bronchial distribution and vasculature are unremarkable. The bronchi are unremarkable. Liver, gallbladder, pancreas. The liver weighs 1,200 grams, has an intact, smooth capsule, and soft brown parenchyma without slippery or nodular texture or masses. The gallbladder contains approximately 5 milliliters of dark green bile without stones or sludge. The extrahepatic biliary system is unremarkable. The pancreas is without hemorrhage or mineralization. Hemic and lymphatic systems. The spleen weighs 60 grams, has an intact smooth capsule, and dark purple parenchyma. There are no major lymph node enlargements. Genitourinary system. The right kidney weighs 130 grams and the left weighs 120 grams. Each kidney has a smooth subscapular surface and unremarkable architecture and vasculature. The ureters maintain uniform caliber into an unremarkable empty bladder. The vagina is atraumatic. The cervical, oh my gosh, something just seriously dawned on me. I'll finish this, but then I've got to say something about these bladders. The vagina is atraumatic. The cervical OS is round. The uterus, fallopian tubes, and ovaries are unremarkable. Endocrine system. The adrenal glands are normal color and size. Gastrointestinal system. The esophagus and gastroesophageal junction are unremarkable. The stomach contains approximately 75 milliliters of a tan, watery fluid without recognizable fragments of pills, tablets, or solid food. The gastric mucosa, small intestine, appendix, and large intestine are unremarkable. Musculoskeletal system. There is metallic hardware on the anterior surface of the cervical spine. The clavicles, sternum, ribs, and pelvis are without fracture. The musculature is normally distributed. So there you go. For those of you who believe that Chris Benoit broke Nancy's back, she had nothing broken in her musculoskeletal system. The only thing of note was she had metallic hardware on the anterior surface of the cervical spine. So she had some kind of neck surgery. And if you watched the video where we looked at Nancy's text message detail, I wonder if this is, quote, the big surgery that she mentioned that Chris's parents didn't come to help her with after she had the surgery. Toxicology. Submitted for toxicological analysis are samples of heart and decomposition fluid, gastric contents, and liver. A separate report will be submitted. Photography. Post-mortem photographs are taken and retained. Evidence. Submitted as evidence are the clothing, scalp hair, ligatures, blanket, and a blood stain card. Opinion. This woman, Nancy Benoit, died as a result of ligature strangulation. There are 2 ligatures that were tightly looped around the decedent's neck, as well as ligatures holding her wrists together and her ankles together. There is also evidence of blunt impact injuries to the head, with resultant subscapular soft tissue hemorrhage, and the lower extremities consisting of multiple contusions. And then it goes on to say, hemorrhage in the soft tissues of the upper back and mid-chest are consistent with some form of blunt impact or applied pressure to either the back or the chest. Post-mortem toxicology revealed a blood alcohol level of 0.184 grams per 100 milliliters. Due to decomposition, blood alcohol test results may be unreliable. Also found in her system were hydrocodone at 0.12 milligrams per liter. And I find it unusual that the hydrocodone is measured in milligrams per liter instead of micrograms, because 0.12 milligrams per liter converts to 120 micrograms per liter, and I think that's high. And then it switches back to micrograms for the rest of the medication, so I don't know if that milligrams per liter is a typo, or if somebody's trying to do something shady there to make it look like the medications are in the therapeutic range when they're really not. Hydromorphone at 28.0 micrograms per liter and alprazolam at 23.0 micrograms per liter. The hydrocodone is within the therapeutic range in a chronic user. Okay, but you're not supposed to be a chronic user of these strong pain medications, so is that a delicate way of saying she was an addict? And the hydromorphone most likely represents a metabolite of the hydrocodone. The alprazolam, in addition to the other drugs, is at a low enough level that none of these drugs contributed to her cause of death. The manner of death is homicide. Then the disclaimer, only those items discussed in the results above were analyzed for this report. The above represents the interpretations/opinions of the undersigned analyst. Evidence analyzed in this report will be returned to the submitting agency. Biological evidence, body fluids and tissues, and fire debris extracts will be destroyed after 1 year. This report may not be reproduced except in full without written permission of the laboratory. This case may contain evidence that must be preserved in accordance with OCGA subsection 17-5-56. And the signature, Jonathan Eisenstadt, Associate Medical Examiner, Related Agencies, End of Official Report. All right, and what I was going to say earlier when I was reading about Nancy having an empty bladder. When I was doing research about the pathology terms, I found some articles that specifically spoke about strangulation death, hanging death, and I'm going to share something here that may be of interest. I found this chart here, Clinical Effects of Asphyxia. And it's one of these flow charts where it starts right here with asphyxia, and then you can follow the arrows. So this is what I want to point out here. When asphyxia occurs, you have sphincter relaxation. And when that happens, what happens is a voiding of urine, stools, and semen. So, when I saw Nancy's autopsy report that said she had a bladder that was void of urine, I recalled seeing in Chris's autopsy that he had a full bladder with 75 milliliters of urine. So, how is that possible if when death occurs due to asphyxia or hanging, you void urine, stools, and semen? I don't know. Is this the smoking gun? Maybe Chris Benoit didn't kill himself. What the fuck? And one other thing that caught my attention was the difference in the description of the color of the ligature furrows in Nancy and Chris's neck. Nancy's ligature furrow was pale and red. Chris's was dry, leathery, and tan. Would that be an indication that perhaps Chris was already deceased when the ligature was placed around his neck? I honestly do not know. Do not take this as anything other than speculation, which is all that it is. I'm not a doctor. I'm not a forensic pathologist. I'm just a person who's reading through these reports and asking questions that come to mind as I'm looking at it. I don't know. Make of that what you will. But I'm going to end this here. As always, thank you for watching. This has been AmKay, and I hope you have a great day. Bye.